So hi, Patty. I'm so excited that you and I get to talk about what's happening in the community around the Latino, Latina, Latinx communities, and really looking at safety and hopefully answering questions, and giving people places to go and resources to have and the combating of the COVID virus in Latino communities. So we're here today. Thank you, Stephanie Rodriguez Salazar, for inviting us. And we're going to so that's what we're going to cover today. So let's talk about the data. I know we're going to show several data slides, and really data is a way to tell the story about community. And as you present, maybe we can talk a little bit too, or at the end, what people are saying and what that means to them, what the data means as our story in our communities.
So let's start out looking at Tri-County Health Department data, and this is for Adams, Arapahoe, and Douglas. And what the case table shows us is that 43% of the cases of COVID in Adams County are reportedly to people who are Latino or Hispanic. And in Arapahoe County, it's 23%. So we know that the burden of COVID-19 on our community is pretty heavy in both of those counties. And then this table is looking at if you had 100,000 people, so let's say 100,000 Latinos, 8,424 of them would have COVID in Adams County, and just a little less in Arapahoe County, which may not seem like a big deal, but if you compare it to other groups like white residents in Adams County, it's 3,000 per 100,000. So again, it's just showing how big of a deal this is for Latino families in Adams and Arapahoe, and that there something's going on. So Charlene, what are you hearing about what's going on? Why is it 8,400 per 100,000 in Adams County?
I think there's a lot of reasons, and people are really talking about why that is, and because communities are asking that bigger question. I think some of the data, we're wanting to make sure that the measurement itself, how people are using the data, the Latino and Hispanic, are these our real numbers? People are thinking that they're getting the data from when people go in for testing, when they're hospitalized, and when they are getting information, or maybe even contact tracing. So there are a lot of reasons why this could be happening. What we do know for sure is the community wants to help protect their families and themselves, and they are doing what they can to protect themselves. Also, some of the data, and I think you're going to get into that. People are sharing. So we have a lot of folks in our community who are essential workers. And we know that that's part of people not being able to stay home. And I also want to share that people who get to stay home, including me and working, and I identify as Chicana and would be considered Latina, I get to stay home, and that's a very, very privileged place to be. And I acknowledge that. And so we have a lot of our workers in our community who are essential workers. They're they might not be in the medical field as doctors or nurses, but they're housekeepers. They're they're feeding people. They're still working. So a good chunk of our community is in the food industry business, and so that in itself is a huge risk for our community.
Absolutely, that's so true. I know I have lots of friends and family who kept working outside of the home during this whole pandemic, including roofers and, like you said, house cleaners, gardeners. And so, they come into contact with people, and so it is really difficult to do those recommendations that we've been hearing over the months. I agree. So let's look at the next slide and look at the data there. So this is just showing us over the course of the several months how the number of cases by race ethnicity, how they've kind of changed over time. And we see right around the holidays, around Thanksgiving and into Christmas, a huge increase in cases among Hispanic and Latinos in Arapahoe, Adams, and Douglas. So that was a really kind of scary time. Look how big that peak is. So fortunately, it's going down, and we just need to make sure it can remain low. So now we're looking at Denver County. And so Denver, what I love about the Denver County data is it shows the proportion of Denver County who identify as Latino or Hispanic. And so in the middle, we see that orange bar, and that shows that 51% of the cases in Denver are reported by Hispanic or Latino residents, but you can compare it to only almost 30% of the residents identify as Hispanic or Latino. So they're overrepresented in the cases. And the opposite is true for the white residents. So you could see how white residents in Denver County make up 54.8% of the population, but only 35% of the COVID cases. So this is exactly how we figure out that there are disparities. That's there are some groups, some communities that are hardest hit. And, we've been hearing this in the news a lot now about how Latinos and Hispanics are hardest hit by COVID, as well as other communities of color. This is looking at hospitalization. So same thing, Latinos are overrepresented in hospitalization in Denver County for COVID, as well as Black non-Hispanic residents.
So let me just address the, just in communities, what's happening. So part of our story, right, is that there may be families, multi-generational families that are living in the same household. So if somebody comes home and they have COVID, and the recommendation is to isolate to quarantine and then to isolate. Quarantining meaning staying in your space, and then isolate and being away from people. That's really hard to do when you live in a multi-generational or a household that has more than a couple of people. And so that's part of the story of what that looks like. And I want to share that, when people say just isolate and go to your room, there is some privilege around that, that everybody, that you have the ability to go to a space where you can do that. So that's part of the story and part of these numbers.
Exactly. So I've been involved in some of the training of contact tracers and case investigators and the resource coordinators. So those are the people that call someone when they have a positive COVID test. And so there's always that kind of figuring out, all right, what is your situation, your household situation, and how can you actually minimize your exposure with other people in the household. And for every household, it's different. Different numbers of rooms, different numbers of people, different kind of family dynamics. So if the main person working has to stay home, then what does that mean for paying your bills? The person who cares for the family and prepares the meals, if that person has to isolate, what does that mean? So yeah, it can be, I think, overwhelming to try to figure out how to manage a COVID diagnosis and try to keep everyone around you as safe as possible.
Yep.
So this last slide is showing a study that was published by Denver Health. They did chart reviews and looked at all of the COVID-19 cases from March all the way through October. And so what they found really supports everything that we've been saying and what we hear in the media. And that is Latinos in particular are more likely to work in an essential industry. So that means Latinos workers have been working throughout the entire pandemic, which also means you have more potential exposure to the infection or to the virus. Also,
Sorry.
this shows that there are more people in the household in Latino families compared to non-Latino families. And so again, going back to what you had said, that how to keep everyone else safe, when you have more people in the home is, it is a challenge. And then lastly, this shows that Latino cases are taking longer to receive their results. So we really need to look at the root causes for a lot of these problems. One problem is having to work while you're still ill. And so that could be worried about loss of income and you don't want to get fired, or you're not sure that you have the ability to take time off. So we need to make sure that there's paid time off, there's income replacement, there's kind of protections in place so that you don't lose your job because you have a COVID infection. Um, and that we really need quick and easy testing and ultimately access to medical care when needed.
Yeah, and so this really talks about symptomatic cases and people who are showing symptoms. And
Mhm.
we do know that it can take up to 3 weeks for some people to show any kind of symptoms and symptoms. Well, they're, they just are like the cold or other kinds of symptoms. And
Mhm.
so this is just folks who are showing symptoms. So for example, if somebody was infected and, was around somebody who was infected and were infected, they may not show symptoms, and being in a household or going to work. um, I have to share with you, most people are telling me that, they're worried. They're worried about their families. They have families that they come home to. They don't want to hurt, they don't want to infect anybody in their household. They do what they can to stay as safe as possible, using their gear, using their masks, washing their hands, and doing everything that's recommended. But if they're essential workers, they have to be in the field, or they have to be,
Yeah.
in their position. And as soon as people are symptomatic, they're paying attention.
Mhm.
So, I mean, we have to look at this whole story and really look at, if some people don't show symptoms right away, somebody can be exposed and not even know it.
Mhm.
So tell us about this slide.
So, in terms of resources, COVID testing is always a concern. And how do you access COVID testing that's either free or low cost? So, Tri County Health Department has a map. These are testing sites. Well, I guess it's not just Tri County because I see Longmont, and that's up in Boulder County. But it's a map that shows different locations where you can go and get tested. There are free no cost testing sites, and there are other sites like in the blue where it does depend on your insurance status. So we recommend that you check them out. We're seeing more of these kinds of maps and lists in order to direct people to where to go and not get stuck with the bill.
Testing is really, really important, Patty. And one of the things that's happened early on, and why we have a health disparity in people of color, and that we saw the numbers go up once testing was accessible to communities of
Mhm.
color, is that it was in certain places, right? It wasn't accessible. So the city and county of Denver has put into place drive-up testing places, and to access the testing, you go online, you just register, but of course, then you have to know how to do that. But if you go on Denver Gov and look for COVID testing, it will be there. But if you want to take a test, you would go to Denver Gov /government COVID-19 information, and that page will tell you how to get tested. You click on there. And so for folks who aren't really technology savvy, we ask you to help them out, help other folks out. I can tell you that I personally was tested and went through the process. That testing in particular that the Denver City and County of Denver has in there, that's for folks who don't have insurance.
Mhm.
And it does take a couple of days to get back. It is a swab, but it's fairly easy. They do the swab, so it's a little uncomfortable, but you get
Mhm.
your tests within 3 to 5 days usually, and they do come through. I believe it's Denver Public Health. partnership with Denver Public Health. So
Mhm.
it's free. It's a drive-through, and it was easy. So there are other options, but part of it is just knowing where to go,
Yeah.
how to get there, and how to access. So if you don't know, you can go to the website denver.gov COVID-19 information
Mhm.
and follow the prompts there. And if we have folks in our community who don't know how to do that, please help them. If they want to do that, please help. Or call Stephanie. Stephanie has her information all over this webcast. So please contact her. She can support you.
Yeah, and I also want to give a shout out to 211.
Okay.
The 211 resource assistance program that's available by phone. You just dial 211, or you can go online and look up 211 Colorado. They have really beefed up their COVID resources, so they also can direct people to COVID testing, and as well as other kinds of resources. So food and housing, transportation resources, which is a little difficult right now, but they're a wonderful resource and have really, I think, made the new COVID resources more accessible to people.
Thanks for that. We know that our communities are also disproportionately, um, losing housing because of not being able to pay for rent. Now, if they're infected, they have to stay home for a couple of weeks and don't always have vacation time or PTO where they can take it off. So they'll, food banks and where to get food and assistance is so important. So thank you for that resource. That's really important. I think you're right. You talked about really unraveling and looking at the root causes. We talk about COVID, and oftentimes we just talk about the medical aspect, but there's so many pieces to this. In our communities are suffering. We're surviving, but we are suffering. So we want to leave you with, I hope we were able to give you good information and let you know that, there's a lot that we can do to stay safe and support each other. Please wear your mask, sanitize your hands, wash your hands, do everything that you can do. Everything's changing. It seems sometimes like daily and then weekly, depending on where you are, right? In the community or your county. Listen to the updates. We know that we have families and we love them and we want to protect them. So, and we know everybody's trying their best. So keep doing that. The governor says to do your part, and let's continue to do our part. We just want to give a special shout out to all the essential workers. We want to thank you for feeding us, for taking care of our families
Mhm.
and being there. You're really the heroes and the sheroes. Thank you.